Ask Dr. Ammar.
It's very important to breathe well. What do you think, Dr. Ammar? This is Dr. Ammar from Elite Orthodontics. I'll be talking about airway and early orthodontics. Question I always hear: does my kid need expanders to improve his airway? What's the best age to see an orthodontist to evaluate for airway for my kid? Usually 8-7 is a good age to see an orthodontist and evaluate your kid if there is a need for airway improvements. Symptoms that could be related to an airway obstruction, which is OSA, obstructive sleep apnea in kids: snoring, grinding, moving a lot during sleeping, being hypo or hyper, getting tired so easy during the day, not able to focus, and sometimes even wetting the bed. And there's multiple other symptoms that we look at, but all of those raise red flag on if there's any airway obstruction. Now, the specialist to see is usually an orthodontist to evaluate how do you look like in terms of bone structure. Does the kid has a narrow palate? Does the kid has a mouth breather? Is he open bite? All of those features can give us a lot of hints of what needed to be done orthodontically. To diagnose sleep apnea, we would send you to a sleep physician to actually do what we call sleep tests, and that will give us a sleep number. And based on those numbers, we'll be able to know if we actually have deficiency in oxygen during sleeping. Now, what can an orthodontist do? Usually, as an orthodontist at early age, I'm able to change the bone structure, not just the dental structure, not just moving the teeth, but we're actually able to modify the jaw growth to a favorable jaw growth. So in airway compartments will be the upper part, which is the nasal cavity, and there'll be the lower part, which is the lower jaw relationship to the face. When the upper jaw is narrow, that means the upper arch is narrow. That means the palate is narrow. And the palate is the floor of the nose. And if your nose compartment is a smaller, then the quantity of oxygen or the breathing volume that goes into your breathing channel through your nose is smaller. So expanding the upper arch will give you a bigger nasal cavity, not bigger nose, just the nasal cavity inside. The lower jaw compartment is, if your lower jaw is a little bit backward, then the bone that attached to the chin is the bone that's holding your air tube. And that bone, in this case, will be pushed back, and that will collapse your air tube, which is a spongy, soft tissue air tube. So the more your lower jaw, more ideally forward, the better your airway is gonna be. I'll show you an example right here, how we assess it. So this is the x-ray of the lateral skull. Now this area is the airway. So if you look here through the airway, you're gonna see it's the dark area, and you see it's very constricted air. The tonsils, the adenoids can play an important role as well. But then what do we need to do to make this better? Sure, if the tonsils and the adenoids are big, we're gonna refer you to the ENT and make sure he takes care of them. But things that we could do, like in this case, see the picture on my right side, which is your left, is showing that the airway volume is here. But look at the airway volume on the after. So not just the smile gets better and the profile gets better because the lower jaw went forward, actually the airway improved, and that's the lower compartment of the face. The other part is the upper part, which is the palate. So you see in this case, you see the picture on the top is the one with a little narrower palate. Picture on the bottom has a little wider palate. What did we use? We used the palatal expander. It's an orthopedic device that we use a lot in orthodontics. It does an amazing job to create more space, make the smile wider and more aesthetic, but actually improve airway as well. The improvement in those cases is aesthetic, breathing, and more space for all the teeth in the future to avoid the need to pull teeth out, which is something classically we do in orthodontics in cases of severe crowding. But doing this phase one will improve that airway and makes it better. Thank you for listening. It was a great session talking about how to breathe better. Thank you and have a good day.